I think there's really growing interest in the area of health literacy, and it's a really important area. And the evidence is really strong around how important it is for people to understand and manage their own health. Lots of people were working on it individually, and we felt that if we worked together and supported them with training and development, we would get much better results than if each organisation tried to reinvent the wheel and do it on their own.
We've come to it from an angle of improving health outcomes for culturally and linguistically diverse communities, but it offers a way to improve access, better access to health services for all marginalised groups.
It really gives the opportunity for both participants to have a deeper study of the subject and think about how it can apply to them at their workplace.
Really raise my awareness about health literacy and how it could apply to my own practice. But I was interested in developing this longer course so that I could go back to my organisation and build the capacity of the organisation as a whole. So hopefully we'll have the skills and knowledge to go forth and make that change now.
So from this course we want to influence people across the organisation at Eastern Health and to overall improve health outcomes for our population in the East.
It's great actually. I'm enjoying the variety of learnings.
It fits in with the role of what we do on a day-to-day basis.
So we started by delivering a short training session to other program advisors and monitoring coordinators to sort of get a bit of buy-in from our peers.
Obviously with a new organisation and a rebrand, you're having to also create new policies and procedures. So we thought this is the prime time to get all staff as well as exec involved in health literacy.
It's just the way that we interact, the way that we speak with consumers. I think it just needs to go across the board.
It does make you more conscious of, the language that we use when we do speak to our consumers, but, amongst ourselves as well. Clarifying, jargon. We need to actually be hearing more of the message of what the consumers are actually telling us and what they're wanting. We also need to provide them with the right information at the right level so that they understand, one, what they're purchasing and what services they're accessing. So how do we do that if we don't have the common language?
The epidemiology that I've studied, it's also how people use that information to affect their health, or vice versa, don't use it and become sick. And it's just a really interesting interaction between the two, and it's a whole ecological approach to health and wellness. So you don't have to have a lot of money to be well, you just have to have the right knowledge to be able to become well or stay well.
The main reason why we were both tasked to come to the health literacy course was to be able to embed health literacy principles into our organisation's policies and processes. It was fun. It was great for us to be able to address it in terms of the health literacy course because we were actually committed to doing it.
The opportunity is there, so the organisation is really well placed to bring in, change, and it was good to just get, a bit of a different perspective and to look at ways that we could improve on what we were already doing.
We've gone out to sites and had a look at navigating the site and how easy that was with a tool. So I found that really valuable.
I like that we're doing projects and you get to take what you're learning into your workplace and implement it.
One of the best exercises I loved was the wayfinding. Because I think if you go to any organisation, you'll be challenged in some particular way about finding your way, finding where the disabled parking is and all of those things. So, I love it. The presenters are great and it's also a great networking opportunity.
I think what I really like about this group is that they are happy to put their ideas out there. They're happy to think and they keep it informal, but they still are here to get what they can for their organisation out of this process.